Hey, you guys, welcome back for another week of topics and tips. As we kick off this month, as promised, we are covering everything non clinical. So, we're doing a non clinical series. As we prepare for boards, you always hear that umbrella scenario of non clinical content. So, I'm going to break it down to make it a little bit easier so you know what falls into that, right? So, this first week of the series, we'll be covering research topics under that. A lot of people get so hung up on this non-clinical content. And I tell you guys, if you ever take any of my courses, I go through all of this and I let you know that half the battle is knowing what to study. It's not that that is so difficult and we can't understand it, but we typically just hear it as non-clinical. And it's like, so what falls under that, right? So you can know what to study to prepare for it. And then the second thing that people always ask is, are there non-clinical questions on the AAMP exam? And there are. Now, yes, granted, ANCC is saturated with it. It's over 60% of the exam. But the AAMP also has non-clinical things. Just oftentimes it doesn't look as though it does because the actual question is testing on something else, but the scenario includes non-clinical information in it. So for example, they may mention different cultural practices in the scenario, but the question is asking you about blood pressure or diabetes, but you still need to have some knowledge of those cultural practices to help you gauge how to answer the question. So I say, hey, everybody needs to study it, right? All right, let's get into it. All right. Hey, y'all. Hey, y'all. Welcome back. I like to give my disclaimer before I get into the content on my videos. For those of you who are new here or new to any of my videos or content, I am Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I design these videos and my resources and material for you guys to help nurses and nurse practitioners to learn the material easily, but to also be successful on boards as well as in practice. Now, I say all this to say this is not all encompassing. In medicine, nothing is absolute. So, we gauge our patients on a patient by patient basis, scenario by scenario, right? So, none of this is all inclusive. This is to help you on boards as well as in practice to get you started to give you this information so you know how to move and how to study and to take all the fluff out of things and to help you retain the content a bit easier. So, let's get into the material. All right, you guys. First topic, relative risk. And I'm going to tell you before I get into this, a lot of the non clinical content is terminology. So some of this stuff, you're just going to have to get the definitions because it is what it is. Again, half the battle is knowing what to study. Now, some of this stuff, it just really needs to be broken down, and I will do so. But some of this stuff is like, hey, this is what it is. Know it, study it, retain it. Like I do anything else, I'm going to give you this content this day. Wednesdays, we're going to work it out and test it and put it in a practice question format to gauge your knowledge. But this week, for my Thursdays, last month I did a soap note series. Thursdays this month, the series is going to be repetition just because it's so many terms. I'm going to do some repetition to kind of help you retain it. Okay. All right. So relative risk. What is that? Relative risk is the ratio of the probability of an event occurring in an exposed group compared to the probability of it occurring to a non-exposed group. I know you're like, what, Brittany? I know. I was there and I know how these terms get. You know how you heard it or you read it, and it's like you got to go back like you're just getting hooked on phonics and say, this is the ratio of the probability. All right. I'm going to try to make it make a little bit more sense to you. So the relative risk is simply saying, what is the probability that this group over here who was exposed to something may get this thing or may have this occur compared to this group over here who wasn't exposed? So let's use COVID for an example. Since that's something very common right now. And I'm going to put them as group A and group B. So group A is going to be our exposed group, and group B is going to be the non exposed group. And the relative risk is truthfully an equation. You're dividing the numerator versus the denominator to get the relative risk of this occurring. So again, group A will be our exposed group, and group B is going to be the non exposed for my example on this COVID relative risk scenario. Okay. Y'all following me? So, group A, my exposed group, will say 25% of these people were got COVID after being exposed to somebody who tested positive for COVID, right? Now, group B, our non exposed group, only 1% of those people out of that group got COVID, but they were never exposed to anyone with it. So you divide the numerator to the denominator, all right? So 25 divided by 1 equals 25. So the relative risk is 25% more likely that the people exposed to COVID will get it compared to those not exposed. Make sense? So, what is the relative risk of this happening? So, you want to look at the probability of it occurring to the exposed group compared to the probability of it occurring to the non exposed group. Relative risk. Boom. I hope you got it. Put it in the comments. Say, got it. Say, Brittany, I need you to go over it a little bit more. Tell me what you need me to do. But hopefully that helped make it a little bit easier to understand. All right. Next, qualitative versus quantitative research. Pretty simple, but when you're thinking of these things, I want you to really be able to gauge which types of research fall into these categories and not just knowing the term, okay? But to start you out, go to the root. When in doubt, do your medical terminology, right? All right. So first we'll start with qualitative. Now, qualitative research is more of that subjective data. Is non-numerical because we know like quantitative, we think of quantity, that is the numerical version. Qualitative, we're not looking at the numerical aspect. This is where you are gathering data from different sources more subjectively and analyzing it and putting it together without having numerical measures, right? So in this stance, that'll be things like interviews, so interviewing them to gain research, doing focus groups to gain research, okay? So getting that, I say, quality data put together but not into a number fashion. Now, quantitative research, quantifying something, think of it that way, is something that's measurable, something that we can measure, something that is numerical. So again, think of that term quantity. So that's where we're going to start to look at the data with number basis, almost how we were doing like the relative risk numbers and things like that. You're going to start to compare and put percentages and look at different numerical values to quantify those research styles. Okay, so quantitative versus qualitative research. Now, y'all know I tell you, make sure screenshot, write it down, hang it up on your walls. You need to study it. You need to know the research hierarchy pyramid. You got to know it. You need to know what you need to know, what type of studies are stronger than the other. And the pyramid puts it all into perspective for you. Come up with a rhyme or reason for you to remember, but you need to study it, write it out, make it plain. That's Bible. Write that thing down so that you can know, because you're gonna need, because you need to know this on several ways. Because when we think about strongest to weakest, they're all good sources, but it's letting you know the validity of the different types of research, right? And data that you're getting. So even in question formats, to understand which one that's going to give you more, that has the strongest foundation and validity, based off of the style of research, is based off of this pyramid. So you need to know these things. So look, I can't tell you anymore. So I I can't stress it any more than that. Just know it, okay? And thank me later. But it'll help you because, and I like to say it in this fashion because as we do it, it's so many things to know. And that's why I stress the pyramid so much. So many things to know. Okay, what is a randomized control? Oh, okay. Is this one stronger than this one? Is this an case study, cohort, all of these things, and then trying to understand if it's stronger or weaker. If you know it from the pyramid, that's half your battle, right? So I've tried to give you easier ways to study it so that when you're looking at it, it's easier to break down those questions. It's easier if you're doing things on a research level to know which ones, like from a doctoral standpoint or things of that nature, which ones to go to for more of a stronger credibility, etc. Like this is your foundation when you're considering all of those things. So know it. And I say Google it. Google it, print it out, hang it up, write it down. Um, I Googled this image as well, just so that you can get this idea. But let's get into each one of these, okay? All right. So from the top, systematic reviews is the strongest. Now, meta analysis are up there with that, but systematic reviews is at the top, tip top. Always know that. So, how can you remember that? Systematic reviews, they're at the top because they review everything. They gather, and when I say that, I mean they gather all research to answer whatever that topic we are researching. They gather all the data from all research areas, and that's why they are deemed more credible, because and the more reliable source, because they have looked at everything. So there's not any that limits the risk of the bias, so to speak. And I say to remember that systematic review is reviewing all systems. We review everything. And so they run everything because I've reviewed everything. I run everything. I run all the systems because I reviewed all the systems. So I'm at the top of the system. Remember, systematic review is the strongest, right? Now, again, when in question, that meta analysis is up there too, but that systematic review still trumps that because the meta analysis still kind of narrows their searches more from a statistical standpoint, but they kind of say that can lead to more bias. I'm trying to find the best way to make that easier for you to understand. Whereas reviewing everything, so like, hey, I went through all systems and got everybody's side of the story. So I did my research and I know what's going on, versus I just went statistically and just looked at this population over here. I did cover all bases with that, but you see why that systematic review would be stronger, because it's covering everything. So again, we reviewed all systems, we run all systems, we at the top, right? Next, we got the randomized control trial. Now, randomized control trials are also up at the top because they're at random. So that also limits the bias of it. So it's not like they're random but controlled at the same time. So, all right, what does that mean, Brittany? So we're controlling. So a lot of times you see randomized control trials, for example, with like new treatment options, like new medications out, or new surgical devices or procedures and things of that nature, so that you can see one versus the other. So thinking like blood pressure management. If there's like a new blood pressure medicine, we can use a population of, and what we're going to control is all females ages 35. So they're the same economic stature, same diet, same gender, same age, controlled. But at random, half of them will receive this medication at 10 milligrams, and the other half will receive it at 20 milligrams, to see which one had a better response, blah, blah, blah. And I know that's not the best scenario, but just giving you the understanding of how it works. So it's controlled because the population and things are controlled. So it limits that bias, but it's randomized. So it's not saying that, oh, I gave a young, healthy female the medicine versus someone who has a history of hypertension, diabetes, and all these other factors to see how this will work. So this is the treatment is provided at random, but the population is controlled and it limits the bias. So it's up here. So that's number 2. Okay, that's second on the list. So the people who review all systems in that systematic review run it, because I run all the systems. I review it. So next we have the people that randomly start to take control. That's next in line. Now we have the cohort studies. And I said with cohort studies, it's kind of simple. Just think of like a cohort in school because you're studying a group that has similarities. So when you're in a cohort, like in class, you're in your cohort in MP school. Your similarities is that we're in this graduating class together. We're studying for the same thing. So they're studying that group of people. Okay. Then we have our case control study. So with the case control study, it's going a little bit deeper from a different perspective. Because oftentimes people kind of get cohort studies and case control mixed up. But the cohort study is looking at a group of these similar things, still looking at like exposed versus non exposed, right? Whereas that case control is going to go backwards. So let's take it from the MP perspective that I was talking about because we're thinking of cohorts. So think about your graduating cohort are preparing for boards, right? So those out of your cohort who took the nursing studio review versus those who weren't exposed to taking the nursing studio review course, looking at how they pass boards. So it's studying the cohort, right? From those exposed versus non-exposed. But when we look at the case control, it's now like kind of going retrospective because we're digging a bit deeper and going at specific cases, right? So how well were the people who were not taking the review doing at that time, and what were their scores? Like digging deeper. And I know that might not be the best example, but I'm trying to give you a vision on how it looks at it a little bit different because the cohort, we're looking at a cohort or a group with the similarities to see that disease or that cause from non-exposed versus exposed, whereas the case control is coming backwards and looking at what risk factors were in place that could have caused that for each group. I hope that makes sense. And then next we have our case series and case reports, and then lastly those editorials and expert opinions. Now again, I want you to write these out because it's really, knowing them from strongest to weakest, but I'm trying to go through and give you some foundational knowledge so you know what it is too, okay? Now those case series and case reports, again, like we're talking about the case control studies, we're looking a little bit deeper at this particular population, right? So in the cases like again, back when we were talking about COVID, so really getting all of the characteristics and things of the people who in that case were diagnosed with COVID in 2020, type of thing in that pandemic. You- Who, when we're looking at that case of population, just getting all those descriptive factors and data, looking back to see what criteria and things and everything that you can gather is research for that particular case. And then the editorials and expert opinions are just what they said. Is getting those things, getting those expert opinion. What is the expert opinion on the flu and things of that nature? So as you can see, it makes sense on how the credibility, reliability, validity of these things strengthen in the research based on how we go about it. Because expert opinion, I'm asking you, yes, you're knowledgeable. Yes, that is good research, but that's on the weaker. Whereas the systematic review is the strongest because it's looking at all systems, it's researching all of these areas. So there's very little bias, I should say. And so because they're covering all bases, whereas with the expert opinion, I could be biased about um, taking a review versus not, because of that's what I do. Or I may be biased on a certain thing with cardiology because that's my background. Whereas when you're looking at all of the aspects, you can get different feedback from all sources to get a more credible and unbiased research data and analysis. Okay. So hopefully that helps to tie those things together. The longer version than short, but I wanted you to also understand what each of those are, so you have the knowledge as well as the easy way of remembering those in order also. All right, next, experimental research. And so experimental is just what, if you think of an experiment, it's just random sampling to conduct the experiment. So you're just randomly experimenting, so to speak. So simple, what the terminology we know. Now, quasi experimental is not randomized. So to try to break that down a little bit easier, it's still an experiment. So we're testing something to see, like, hey, if I do this, this happens. So cause and effect, in an experiment, but it's not at random. So yes, it's controlled because we are experimenting and we are, like I said, looking to see, if I give you this medicine, what is the effect? Cause and effect, right? Whereas with experimental, it's a true experiment because it's at random. And then you see what the effect is randomly. Whereas with this one, you're controlled and say, hey, if we do X, then this happens. You know what I mean? So I hope that makes sense. And then lastly, and y'all, it's so many terms, but again, I'm covering research. Um, there are researchers that you can spend some time going and familiarizing yourself with. But I really wanted to take a moment to delve into these topics so that you would know the terminology, know what areas to study. If you struggle, let me know. We can go a little bit deeper. You can do your research on it to get you, whatever, because everybody learns differently. So whatever learning style you need to help you to retain it, flashcards, quizzing yourself, making posters, having somebody to test you, listening to this repetitively, writing it out, whatever that source is, I wanted to give you the terms so you know what to look for, you know what to study, and you have a foundational knowledge of what it is. Okay. So the last one I want to go over with you today is the root cause analysis. And this is an approach designed to break down and analyze the cause of an adverse event. So, getting to the root of it is simply what it is. You're doing an analysis to see what the root cause was. Simple as that. Okay? All right, you guys. So that's it for this week's topic of research on the non-clinical series. Next week I will be covering the cultural topics of the non-clinical series. So make sure that you are subscribed so that you are getting those notifications so that you will know when the new videos are out. Um, like I said, it'll be cultural topics, so we'll be covering all the cultures. We'll do on the cultural terms, cultural competence, cultural beliefs, all of those different things we'll be covering next week on the series. But as always, you guys, thank you for watching. Please be sure to like, comment, and subscribe. Share with whomever you may think that may find this helpful as well. But meet me back here tomorrow for Work It Out Wednesday as we work through some of these terminologies in a practice question to test your knowledge on these research theories, and so you can see it in a fashion of how I am delivering this to you so you can understand what I mean, to know how to apply it and how to break down those practice questions as far as the research content goes. But continue to follow, because I am going to be doing all of this for this entire month to cover that research, the culture, HIPAA, CMS, billing, the legal topics, and those professional issues that for some reason everybody comes to me and stating they have a lot of hurdles with that topic. So make sure that you again, have your notifications on so you don't miss out on this information. All right, you guys. Bye, y'all.